Good evening. Hi, I'm Dr. Jason Kessler. I am a real board certified pediatrician and an experienced parent. And I started the Dr. Jason channel to help fill in those gaps for parents like you who have 15 minutes with your child's pediatrician and lots of questions. And in the real world, you go home and you might have got lots of information from your child's doctor and you still have questions. So I'm here to fill in those gaps. This is the very first Dr. Jason Live. So thank you for joining me. I apologize ahead of time for any technical glitches. I've never done this before, so there may be some. I'm here to take questions from you, and I'm going to get started with some questions that were sent to me ahead of time. But as you have questions about anything in parenting or pediatrics, go ahead and post those questions, and I will get to as many of those as I can. And some of the ones that I don't get to, I will post videos on later on. This live broadcast is only scheduled to be a half an hour, but I do plan to do these regularly. In fact, the first Wednesday of every month at 7 o'clock, at least that's the schedule for now. So plan to stay tuned to the Dr. Jason channel for more Dr. Jason Live. So I'm going to start with some questions that I had ahead of time. And one is just how much crying is normal for a baby. And it's difficult to listen to crying because you always think something's wrong, but it doesn't always mean that something's wrong. It's normal for a baby to cry for several hours out of the day in their first few weeks. 3 to 4 hours a day of crying is normal. And when you think about what a baby does all day, they sleep for maybe 20 hours of the day, eat for another hour, and then the remaining time is spent crying. But that's normal. So don't get too freaked out by the crying. Now, when babies reach 3, 4, 5 weeks of age, there may actually be an increase in the amount of time that they spend crying. Some babies will develop the condition we call colic, which is a lot of fussiness, a lot of crying. Usually there's a pattern to it, oftentimes in the evening or night hours. We don't necessarily know why. It doesn't seem to be harmful to the babies, maybe more harmful to the parents having to listen to it. Lots of tricks that you can do to help calm your crying baby. And I'm planning to post a video on that soon. I recommend a method developed by pediatrician Harvey Karp out of UCLA, who developed the Happiest Baby on the Block method. He uses what he calls the 5 S's to help babies calm and comfort. They are all things that are designed to basically remind the baby of what life was like in the womb. So the 5 S's include swaddling the baby, placing the baby on a position on their side or stomach, and gently swinging the baby, shushing the baby, which can be any source of white noise, but just a shh sound, vocalizing is as good as anything, and sucking, providing the baby something to suck on, a pacifier, or a clean finger, or a breast, or a bottle. So I have a question coming in from Kate here. She says, my son has been having angry outbursts whenever he's trying to eat something other than chicken or macaroni, and he throws food. And she asks how to deal with this. So lots of really difficult behaviors that kids will throw out around eating. So the real keys to this, and this is much easier for me to say than for you to do. I know this is difficult at home, but you have to be very patient with your child, and you have to be very persistent. And so that means that you take advantage of those times when you know your child is hungry to give them foods, but give them not their preferred foods first. You know there's going to be battles when you start doing this, but over time it does get better. And offer them a good variety of foods. And if over time you can get it so that just putting those foods in the mouth, taking a bite or two is all that happens, that's a victory. That's a big victory right there. But you just got to keep putting those foods in front of the child, and you'll have the best luck when you know the child's hungry, when they've been active and playful. Wide variety of foods, but small amounts. Don't ever put a big plate in front of the child, because that'll intimidate them. But just small amounts, wide variety of foods, and do this every day. Every day, put some fruits and vegetables, and then your child learns a lot about eating from watching you. So you have to analyze your own eating behaviors to see if the things that you do are positively or negatively impacting your child. So if you're a picky eater, chances are your child's going to be pretty picky too. So showing them what fun you're having trying new foods will go a long ways. And I tell parents to act this up. Make a big deal out of it. Be bigger than, show more fun than maybe it is. Kids want to be in on that fun. When they see you having fun, they want to enjoy that. So, oh, this is so yummy. This is carrot. It is delicious. Boy, I really like this. I'm having so much fun here. Oh, and look at, so we've got some, what is this? A strawberry? Wow, this is really yummy. Act that up and play that up really big. That works really well, but it takes time. You will be dealing with the battles and the throwing. Now, don't try to force your kids to eat. Don't try to make it more of a battle than it is. The more of a battle it is, the more you've lost when you started. All right. So try to keep it upbeat, light, fun. If they're not ready to eat, okay, they don't have to eat. Kids are much better eaters when you get them at the right time. So sometimes just aborting the effort, going back to something fun to get them hungry, get them in the mood to try new foods. But my keys for feeding kids are patience and persistence. And I've got a couple of videos out now about feeding picky eaters and kids with poor appetites. You might want to take a look at those too. They've got some good advice there as well. So thanks, Kate, for that question. What should I do when my baby has a fever? Well, fever is one of the most misunderstood things in all of pediatrics, and people get really afraid of fever. Fever is a sign of an illness, but the fever itself is not the illness. Fever is a symptom. And in fact, fever is good for the body because your body's infection fighting machinery works better at a higher temperature. That higher temperature is also not as good for many of the germs that may be infecting the body. So don't panic when your child gets a fever. Know what it is. It's a sign of an illness, and it's those other symptoms of the illness that you really want to pay the closest attention to. Now, normal body temperature is 98.6 degrees. I generally consider about, give or take, 2 degrees to decide when a fever is. You only tend to see low temperatures when kids are sick in really young kids and babies. It can happen in older kids. That's usually a sign of a more severe illness. But chances are, if you're getting a low reading off your thermometer isn't reading right. Particularly those ear thermometers have a tendency to read really low, particularly if you don't get a good seal on the ear. So, but back to the temperature itself, 98.6 is normal body temperature, right? So we give or take about 2 degrees. I consider 100.5 or more. 100.5 is easy to remember. 100.5 or more to be an actual fever. Less than that, well, it's not really a fever. And generally speaking, low-grade fevers in themselves are not harmful. So if you got this fever of 100 point something, even 101 point something, once you get up in the 102 range, you want to be a little bit more cautious about it because it may or may not be sign of a more severe illness. But it's what else your child is doing that I really want you to pay attention to, right? Are they breathing well and normally? If they're not, they need to be seen, no matter what that temperature is. Are they acting like they're in pain? Is their throat sore? Are they pulling at those ears? Could they have an ear infection? Are they having tummy aches or throwing up, diarrhea, things that might get them dehydrated? Those are the most important things to pay attention to. And then when you check that fever, when your child does have a fever, pay more attention to how the child feels than the number on your thermometer. Sure, that number will tell you if they have a fever, but it's really how your child feels that's the most important. As I said, fever itself is actually good for the body. So if the child is feeling fine, you don't need to treat that fever. You don't need to do anything about it. If the child is not feeling well and they're feeling crummy, even if that temperature isn't quite a fever, go ahead and give some Tylenol or Motrin to help make the child more comfortable, bring that temperature down. So so if I also just want to mention, just in that same breath, about Tylenol and Motrin. Tylenol is acetaminophen. The generic is the same thing. You don't have to buy brand name Tylenol. Tend to refer to it by that brand name because people know that. Ibuprofen is Advil or Motrin. And again, there's the generic ibuprofen is just as good as the brand name stuff. The flavor may be different. The availability or the packaging might be different. The strengths on them are all the same. So the dose should be the same, whether you get generic acetaminophen or you get brand name Tylenol. That dose should be the same. When you see dosing references, I hand my patients out a dosing reference for Tylenol and Motrin pretty frequently. It has dosing based on age and based on weight. If you know what the weight is always the more accurate way to dose medicine. So dose based on the weight. And remember, you're treating to make your child feel better. You're not treating just to bring down that fever. You bring down the fever because it makes your child not feel good. So I have a question in. My baby is having problems burping. How do I burp my baby? I'm bottle feeding. That's a great question because we have plenty of instincts in taking care of our kids, but burping is a little bit different. Now, the reason we burp a baby is because when they drink, when they eat their milk or their breast milk or their formula, they take in some air too. They always take in some. And it's that air, those gas bubbles that really make the baby burp. They tend to collect in the top of the stomach. We all eat and drink and we get gas bubbles, and we may or may not burp, but it tends to be less significant when your tummy is bigger. When your tummy is only, yay big, that's a newborn's stomach size, about 3 ounces. It doesn't take much gas to make a great deal of difference. Now, different babies will burp a little bit differently. And the traditional way of burping, you'll hold the baby over your shoulder and pat their back to help them clear that gas or air. That works very well for many babies, not as well for others. If that's not working really well, try adjusting the position that the baby is in. Maybe facing you, facing away from you, facing to the side, maybe not quite straight up and down, maybe a little bit to the side. Try experimenting with that. The best way to burp a baby is to kind of cup your hand so that your hand gets a little air against the surface of their skin. And that makes a little bit of a vibration in the baby's tummy and chest that will help the baby burp a little bit better. So that cupping motion may help. If you're really not getting anywhere with that, you can take a small plastic container. And the only thing I have here as an example is the cap from a baby bottle, but this will work for now. And you can gently do with that. Just be sure it's not sharp or terribly hard, and that you're doing it gently. These are some tricks that you can try. Now, the other thing that you can help to control is how much gas that baby is swallowing. And particularly for a bottle-fed baby, really watch that bottle fairly closely. I have a bottle here somewhere, yes, and I don't have anything in this bottle to really show you, but when the baby is eating the bottle, there is a fluid level somewhere along here. And you want to make sure, where you can see fluid and you can see air. You want to make sure that the whole area that the baby's mouth is on is covered with the fluid. Because if the baby's, if that fluid level is right here and the baby's sucking on this, they're sucking down a lot of air. So making sure that level of fluid is so that the baby's getting more formula, more milk than air will really help. Different babies will do better with different bottle types. So you may experiment with the different types of bottles and see if you find one that causes the baby to have less gas to burp. And the other thing that sometimes parents don't realize is if you're burping your baby and they're not burping, they may not have anything to burp. And that's okay too. If the baby's otherwise comfortable, don't worry about it. They will be doing okay, and they will be comfortable if you don't burp them, if they don't have anything to burp. There are, those over-the-counter gas drops really don't probably work very well. So I typically don't recommend them. The best I can say about them is that they're harmless. They're not going to hurt the baby, but I'm not a fan of the over-the-counter gas drops. They don't help very well. If your baby seems consistently uncomfortable and unable to burp, you may, I'm not a big fan of changing through formulas for that reason. Sometimes that might help, but chances are it's not the formula. But you may want to actually have your pediatrician or another experienced parent actually watch you feed the baby to see if there's any things that an outside observer can observe to help you. Those are some of my best tips on burping the baby, and I hope that helps you. I'm actually planning to do a video on that topic a little bit later on too. Okay, another question comes in. My baby cries and fights when I'm swaddling him. Is he facing some health difficulties when I swaddle him? Should I continue swaddling him? Chances are there are not health difficulties associated with swaddling if that's the only time your baby is fighting and swaddling. And in fact, many babies do fight the swaddle, but once you get them swaddled, particularly if you do that 5S approach, and I do plan to get another video out that actually shows you how to do that, but if you do all 5 of those S's together, even if the baby fights when you actually swaddle them, chances are they're going to calm down with that. It's always a good idea to make sure that there's nothing hurting the baby when you're swaddling, and the best way to do that is just, you know, maybe bring the baby into your pediatrician. But what I'm going to do if I see that baby is I'm going to basically touch every bony area and make sure there's nothing hurting there. You know, lots of reasons why babies can be fussy, but if it's specifically that they're fighting the swaddling, they may do that. But remember that swaddling actually, when completed, helps remind the baby what life was like in the womb. And that's really the goal of the whole 5S thing, right? Swaddling, they're in a confined space, in an awkward position during those late months of pregnancy, listening to this loud shushing sound of mom's pulse rate. So that's, you know, the whole design of the 5S approach, and it does work very well. It's very effective. So you know, I would keep going with the swaddling. If your baby is not fussy before you start swaddling, there's no real need to swaddle them, so you may not need to in that case. But chances are there's nothing that's hurting the baby in doing the swaddling. The one thing I do want to mention about swaddling, and this has been kind of a recent thing over the last few years, they did some studies that back this up, is that swaddling the baby tightly around the hips can actually worsen if the baby has anything wrong in the alignment of the hips. So like the way that I teach swaddling, swaddles them nice and tight around the arms, but actually lets them kick their legs. And that can be an effective thing. Swaddling tends to not be very effective in babies over 6 months old. Some babies are exceptions. So you know, if your baby's actually older, you may try other methods of calming, you know, but usually about 6 months old. And babies who do well with the swaddle, you can actually wean them from it, but, you know, leave one arm out as you swaddle them, and gradually change that. So I don't suspect that there's anything wrong with the swaddling, but it depends on how fussy your baby is with it. It may not be worth the bother, but chances are it's a good technique. But combine it with those other S's, with the side or stomach position, the swinging, the shushing, the sucking. That will help too. So how often and how much should I feed my baby? That's a great question, and something, you know, you think it'll just come naturally to the baby, and sometimes it does, but oftentimes it doesn't. The best guideline is let the baby tell you when they're hungry. A newborn baby probably shouldn't be allowed to sleep more than 4 or 5 hours before waking them up to feed them. Some babies will sleep through that, most won't. Most newborn babies will want to be fed somewhere between 2 and 4 hours or so. And how much you feed depends on the size, depends a lot on the size of the baby. A healthy breastfed baby, and breast milk is the most healthy, perfect food for your baby. So I encourage breastfeeding, but a healthy breastfed baby, you can't very well measure how much they're taking, so it's hard to know. So you basically do have to judge on how satisfied the baby is when they fall asleep as they're eating, that sort of thing. For a baby who's bottle fed, a typical baby will take, as a newborn, probably 2 to 3 ounces, and by the time they're a month or so old, 3 to 4 ounces. And you know, babies vary a little bit from there. They may go to 3 to 4 ounces. Keep in mind, a newborn baby's tummy tummy, it's only big. It's about 3 ounce capacity, and many babies will eat more than their tummy can hold, and they'll spit up the difference. Now that's not harmful to the baby, but it may be a sign that maybe the baby's overfeeding a little bit. If they're doing a lot of spitting up or spitting up large volumes, you may think about just trying smaller feeding. Keep in mind, if you do smaller feedings, you got to feed them more often. Most babies, and actually almost through most of infancy, should average somewhere around 24 ounces per 24 hours. That changes, it's about 6 months old, we start introducing solid foods, and they still keep about that amount of formula, but then they're eating solid foods on top of that. So we do eat very, very more, or we eat more food as we start taking the solid foods. So another question coming in from the live stream here. My baby got a diaper rash. Should I take him to the hospital or try treating him at home? How do I properly treat him? Also tried different brands of diapers, but still getting rashes. Okay, well, that's a great question. And it is true, sometimes babies will react to one type of diaper or not. If your baby has a persistent diaper rash, it's probably a good idea to have your baby's doctor look at him. You don't need to go to the emergency room or the hospital for diaper rash. It's rarely an emergency condition. But if it's been going on for a long period of time, I do recommend getting it checked out. Now, you've already tried several different diapers, and that doesn't seem to make much difference. You can try different diaper creams. Most of the over-the-counter diaper creams are about the same stuff, and it's good stuff. Your Desitin or your Balmex, it's usually zinc oxide based stuff or petrolatum. It's a moisture barrier. It's designed to protect the baby's skin from additional moisture while the skin does its own healing job. Prescription creams are oftentimes needed if we have yeast diaper rashes, which are pretty common in babies. You can tell a yeast diaper rash oftentimes by where the redness is, and if you're seeing dots around the edges. Your typical garden variety diaper rash is usually not so much in the skin folds themselves, and does not have dots. It's just a general redness. But where you start to see the dots and a lot of worsening in the skin folds, that's where we tend to worry about the yeast diaper rashes. And I don't need to send you all to medical school. That's what your doctor's trained to look for. So if you've got a persistent rash and it's not responding to just the usual over-the-counter creams, you can certainly try different creams. Some of them do work better than others. For most babies, just a Desitin or Balmex are pretty good. There's one called Butt Paste, which is a little bit thicker, works pretty well for most diaper rashes. And for some of the really stubborn diaper rashes, I like one called Calmoseptine, which is available over the counter, but it's not actually a diaper rash cream. It's made for wounds, and was actually initially designed for stoma care, people who have to have bags attached to their side for eating or pooping or that's what it was designed for. But I guess I don't need to bore you with the history on it. Calmoseptine is pretty good stuff for some of the more stubborn diaper rashes. But many of those more stubborn rashes will have infections with yeasts, occasionally bacteria, but usually it's the yeast in babies. So if it's a persistent rash, you might want to get it checked out. If not, try and keep that skin dry. Good application of a thick diaper cream every time you change the diaper, and that'll help as well. How much sleep should a newborn get? So I mentioned this a little bit earlier. 16 to 17 hours is fairly typical, but many babies will sleep up to 20 hours a day for their first weeks. Those babies who sleep a lot, you may have to be awoken to feed. And then as we get older, our need for sleep does decrease. And most babies actually, do need to get up during the night to be fed up until about 4 or 5 months. Most 6 months old and older than that probably don't need to be fed during the night. They might want to, they might be very used to getting up to eat during the night. Some babies will sleep through the night, which really doesn't mean they sleep through the night. It means they don't wake their parents up. But most babies will sleep through the night first somewhere around 6 months old, but some babies will do it at 2 months and some won't do it till they're 15 months. And most babies will sleep through their night somewhat irregularly throughout their infancy. Which kind of brings me to the next question. A very energetic baby doesn't seem to sleep, gets about 4 hours of sleep and stays awake the rest of the time, and doesn't seem to be upset by that. Doesn't cry much when he's awake, just doesn't like sleeping. Hard to say without knowing a lot about this baby or how old they are, because older babies may do that. You should at least lay the baby down and put them to sleep. They may have gotten to the point where they're so accustomed to playing and doing those activities. And for an older baby, you may be able to send them to bed with a toy. For younger babies, I don't recommend sending them to bed with a toy. For babies who are hard to get to sleep, it may be helpful to let them cry a little bit. I'm not a fan of the cry it out method, what they used to call the Ferber method. If babies are having difficulty sleeping, I do recommend you let them cry for a little bit. Look at a clock. 5 minutes is fine to start with. And you really do have to look at a clock, because if you ever just listen to baby cry for 5 minutes, that's a long time. It'll seem like forever. So look at your clock, give them 5 minutes, then go into them and do as little as it takes to calm them down. Keep the lights low and try to avoid lots of background noise. So for many babies who don't sleep well, a source of good background noise may be helpful. Something like just a white noise generator or a fan. There are phone apps that will just play static white noise. It helps drown out some of the other noises that may be preventing the baby from going to sleep. That light is a really key thing. It's more important as we get older, but in babies, as in everyone, the baby learns what day and night is eventually by cues that the light sends to the eyes. That's how the brain knows day and night. It knows darkness and light. So really taking advantage of that to help the baby set a good clock. So keep the light on when the baby's awake during the day. Keep the lights low during the night. Keep in mind, some babies really don't need to nap during the day. If they're overall getting the right amount of sleep, it's not a big deal that they nap during the day. And if you're not having any luck with those things and the baby's still wired and awake all the time, it might be a good idea to bring that up with the baby's doctor, because there are a few medical conditions that can have that as a symptom. But the need for sleep does catch up with people at some point in time. Everybody needs sleep. We don't know exactly why the body needs sleep, but we do know that the body needs sleep. A 1-month-old baby sneezes a lot. Sneezing is actually perfectly normal. And without going into details of why the baby sneeze, sneezing can be completely normal as long as it's not debilitating in terms of preventing the baby from being able to eat or drink. There's nothing really you need to do about sneezing. It's perfectly normal, and babies tend to sneeze, not always, but tend to sneeze a little bit more than grown-ups do. And of course, we all sneeze through our lives. But the 1-month-old who's sneezing a lot, if that's all it is, no worries about that. Safest sleeping position for my baby. My baby doesn't seem to sleep well on their back. Can they lay on their side? No. There's a very good reason why the Academy of Pediatrics strongly recommends that all babies sleep on their back. And that is that it vastly, it really reduces the risk of breathing problems, including sudden infant death syndrome. Like almost no babies who have died from SIDS were actually sleeping well on their backs. It's really important to always lay the baby on the back, even if they cry. they will eventually get to sleep, but they need to be safe when they do that. And for those of us experienced parents who have been around for a while, the recommendations for sleeping for babies have actually changed a bit in recent years. Now we not only recommend the baby always on their back, don't prop them up on their side, don't roll them over on their tummy, always lay them on their back, and don't put anything else in the crib with them. We don't want babies to have pillows, blankets, crib bumpers, toys, any of that stuff. In fact, we even recommend garments that keep the baby warm to sleep in rather than blankets for the baby. Very important. Baby should always be on their back. Now, I generally will tell parents, when the baby rolls over all by themselves, without anything under them or any assistant, they get that way all by themselves, and they're doing fine with that, you can let them stay that way, but you always lay them down to sleep on their back. Very, very important, very significant. 4-month-old, every few weeks will sleep for 10 to 16 hours straight. No crying, fussing, or anything. If we wake her up, she goes right back to sleep. At 4 months old, I wouldn't be worried about that. If a 2-year-old is doing that, actually, 2-year-old might even do that. Some 4-month-olds just they may not need to get up and eat, but you do need to keep track of how much the baby is eating to make sure that they're getting the food that they need in that time sleeping through. So if they're sleeping for 10 to 16 hours, then the other hours of the day, they're probably going to be eating pretty frequently. But that 4-month-old still should be somewhere around 24 ounces in 24 hours if they were less than, say, 18. Depending on their weight and size, I would bring that up with the baby's doctor. But Jess, who's given us this problem or this question, says she does that every few weeks. So she's not even doing it every night. I wouldn't worry about it. That sounds fine. Her record is 21.5 hours. That's a long time for a baby to sleep. The most important thing is that they're getting up to eat. If you cannot wake the baby, that is a problem. If you wake the baby, they wake up and go right back to sleep. That is not as concerning as if you cannot wake the baby, you do need to have that baby checked out. And as I said, make sure the baby is eating. Chances are during that period of time, they probably are getting up. They're just not alerting you. Like everybody from newborns to older adults, we all get up during the night. And most of the time we just roll over, go back to sleep. We don't really even notice that we were up. Babies may have a harder time with that, and young kids may have a harder time with that, but some may not. Some may do just fine with that. Now, I do want you to be on the lookout for any other symptoms that the baby's having. As I said, if you cannot wake the baby, that is concerning. If the baby is having strange or unexplained movements, seizures, that sort of thing, you definitely need to get that baby checked out. If the baby is jaundiced, their skin color is yellowish or just not right, you don't want to have the baby checked out. So, if you're concerned about the sleep behavior, bring it up to your baby's pediatrician. But from what I know, which is not a lot about your baby, I wouldn't worry about a few nights here and there where we sleep for 10 to 16 hours. That could be normal. Let's see, how much spitting up is normal? That varies a lot from baby to baby. All babies have some degree of reflux. And if you think about what happens when a baby eats, they swallow, it goes down a little tube called the esophagus and into the stomach. And there's just a little muscle at the top of the stomach that squeezes down to hold food in. But in babies, that muscle tends to be sort of loose and floppy. And as the stomach starts moving and squeezing to digest foods, that loose floppy muscle allows stuff to come back up, and that's what causes the spitting up. Also, burping can contribute to the spitting up too. So as long as the baby is eating well and holding down a good amount, they're doing okay. Remember I said that baby's tummy, the newborn's about 3 ounces. It gradually increases from that. But if they're eating much more than that at a time, the difference will come back up. When they spit up, it's a big mess. It's all over the place. It looks like it's everything they ate or a whole lot of it. But as long as the baby is growing, your pediatrician can measure that, and the baby is not showing any signs of like dehydration or anything like that, which lots of things you can look for dehydration. I usually just tell parents, look inside their mouth. It should look moist in there. If it looks dry inside the mouth, don't count the lips. Dry for other reasons, but inside the mouth, looks dry in there, have the baby checked out for dehydration. But really, spitting up, it can be as often as every time they get fed, even more than that, particularly when they get laid down after feeding, and that is completely normal. And it may look like it's an awful lot. It probably isn't in reality. Now, if you see a big change in the way that baby's spitting up, that could be a sign of an illness. So you might want to have the baby checked out. If the baby is projectile vomiting, spitting up is usually just kind of loose and makes a mess. But if they're really spitting out and spitting up, you may want to have the baby checked out for that. There are a few medical conditions, particularly in the first couple of months, that can lead to that. And can have other complications, so you want to get that checked out. But for the most part, a baby who spits up every time they're fed, and maybe again when they get laid down, or their position changes, that's pretty normal. If your baby spits up a lot, as I mentioned, smaller feedings maybe a little more often may help. Also, just keeping the baby upright for a little while before you lay them down, that may help decrease the spitting up also. Okay, so I've already gone over my time here, so I'm going to go ahead and end today's Dr. Jason Live. Thank you all so much for joining me, and I hope you'll continue to join me in the future. And thank you to those of you who are watching this video after the fact. I hope you got as much out of it as everybody watching. If you have topic requests for other Dr. Jason videos, please let me know. You can just drop it in the comments from this or any of my videos, or send me a message to let me know what topics you'd like to hear about, you'd like me to make videos on, to submit a few questions ahead of time for Dr. Jason Live, and it'd be great to hear from you. Always interested in your input. Thanks again for joining me. Parenting is tough, you guys, but parents, you got this. We'll see you next time.